Our last topic from the McKinney Chapter 43 on childhood gastrointestinal alterations is going to be short bowel syndrome. Short bowel syndrome results from essentially what it sounds like, a decrease in the length of the small intestine. This could be because of a congenital malformation, so something that the child is born with, or surgical resection that results in the decreased length of the small bowel. A loss of greater than 50% of the small bowel may result in generalized malabsorption, or depending on the area of the small bowel that's been removed, specific deficiencies of certain nutrients might be related to that region that was removed. Causes of short bowel syndrome include congenital short bowel, surgical treatment for necrotizing enterocolitis, meconium ileus, intussusception and volvulus, Hirschsprung's disease, Crohn's disease, and trauma. So the decrease of the bowel means that there's going to be inadequate absorption of fluids, electrolytes, and nutrients. Like I explained earlier, depending on the aspect or the part of the small bowel that's missing, we might see decreased absorption of specific nutrients. For example, if the proximal jejunum is removed, there's going to be decreased absorption of carbohydrates, proteins, iron, and water-soluble vitamins. If the ileum is removed, fluid and electrolytes are going to be affected due to decreased absorption of water and sodium. Short bowel syndrome usually manifests in infants as children as watery diarrhea, steatorrhea, that fatty stool, bloating, excessive gas, foul-smelling stool, decreased appetite, vomiting, weight loss, inability to gain weight, and fatigue. Complications we've already pretty much talked about, but malnutrition, dehydration, electrolyte imbalance, gallstones, kidney stones, excessive bacteria in the intestines, and those vitamin and mineral deficiencies like vitamin D, magnesium, calcium, and vitamin K, and those all obviously create their own specific problems. For example, if a child has decreased vitamin K, they might have increased bleeding times. Nutritional support is going to be most important for these patients. They generally are going to have, right after surgery, if it's not a congenital short bowel syndrome, if it's a surgical short bowel syndrome, they're going to have TPN initially after surgery, and then they're going to be transferred into enteral nutrition as soon as possible. It's important for these, especially the young children, the infants and the small children, to have oral stimulation. These kids who are having TPN or enteral feedings via tube need to have oral interventions that allow them to learn how to suck and swallow so that they don't have oral aversions later in life and eventually could potentially start eating orally rather than through a tube.